Hey everyone, and welcome to the Balanced Bodies Blueprint. I am your host, Vinny Russo.
And I am your co-host, Dr. Eryn Stansfield.
And we're shifting gears from all the conventional fitness narrative you hear on most fitness podcasts, as our main emphasis lies in preventative healthcare, adopting a holistic approach to nutrition, and challenging the traditional views on various fitness topics.
Our mission with this podcast is to provide you with the information you need to achieve optimal health.
And on today's podcast, we are going to be discussing Lyme disease.
Disgusting or discussing?
It is disgusting, isn't it? We're going to be discussing Lyme disease. And this is something that we've actually seen our own clients talking about or asking you about a little bit more often.
Yes. So the reason I thought of this topic, I have a personal story, and then I see a lot of patients coming in and saying that, they think that they might have Lyme disease because a clinician told them that might be the case, or they got tested for Lyme disease. And it seems to be happening with people that have very non-specific symptoms. So they think something's wrong health-wise, and they get basically the whole gamut of testing. And in that gamut of testing, the clinician, whoever they're seeing, has done some panel for Lyme disease, and it's not always indicated. So I want to talk very clearly about who should be tested, why you should be tested, and it's not just for non-specific symptoms.
Well, let's just start with the basics then. So Lyme disease is known for its pretty diverse symptoms, as you kind of just alluded to. So what are some challenges that clinicians actually face in diagnosing this disease, especially when patients present it with more generalized symptoms?
So I think that's it right there, the key, right? So a lot of clinicians are faced with these patients that present with generalized symptoms, so very non-specific symptoms, general malaise. And what I mean by that is just general fatigue, not feeling well, not feeling like themselves, but there's nothing really specific. And it doesn't clearly indicate a specific diagnosis. And so I think a lot of these clinicians are stuck trying to figure out what might be wrong with their patient. And sometimes they'll reach for the diagnosis of Lyme disease. But it should be suspected in patients who are at risk of exposure. So you got to think of the exposure first. So the exposure are ticks carrying Lyme disease. And in combination, so you have to have both. You have to have the exposure, and then you have to have the clinical manifestations that are consistent with Lyme disease, and we'll talk about those.
Yeah, so what I've been hearing and actually seeing a lot on social media is this prevalence of Lyme disease. So it actually seems to be increasing. So let's dive in a little bit to the statistics.
Yeah.
Why are these numbers higher than previously reported? Is it because there is more testing or better testing, or is it just a hot topic?
So I don't have a clear answer as to why the numbers are increasing. What has been observed is that the diagnosis has been increasing. The CDC, so Centers of Disease Control and Prevention, estimate that approximately 476,000 new cases of Lyme disease occur in the United States every year, and that estimate is higher than previously reported figures. For example, from 2005 to 2010, it was estimated to be about 329,000 cases. So we're up, over almost 100,000 plus annually reported cases in the U.S.
Well, are regions in the U.S. where Lyme disease is more prevalent, and doesn't matter if it's hot or cold or specific seasons? Because I'm thinking ticks, and I'm thinking deer, and I'm thinking maybe hunting season where deer populations are pretty high. It might be you might see more cases then. Yeah.
So Lyme disease is a spirochetal infection caused by,
it's fun to say,
I know, the Borrelia species, and there's a couple different ones. The organisms are transmitted by the bite of the infected, and I'm probably going to butcher this name, Oxydes ticks. So basically a specific kind of tick. And I think what really gets me is that a lot of people that are even getting screened, which screening for Lyme disease without clinical suspicion is not recommended. A lot of these patients don't even have exposure to ticks. And so that's where I have an issue with with a lot of these clinicians that are doing like this inadvertent testing, essentially, because some people don't even have the correct exposure. So patients are at risk for Lyme disease if they are from or have traveled to an endemic area. So not only do you have to be exposed to the right organism of tick, but you have to be in the primary endemic areas, which are Connecticut, Delaware, Maine, Maryland, Massachusetts, Minnesota, New Hampshire, New Jersey, New York, Pennsylvania, Rhode Island, Vermont, Virginia, West Virginia, and Wisconsin. And transmission is higher from May through October. So yeah, you might be kind of hitting that early hunting season. But I think my biggest pet peeve is when people who have never, we live in Utah, for example, who have never traveled outside of Utah, don't have they're not in an endemic area, have never traveled there, and two, the likelihood of them being bitten by a tick is very, very low. Not to say it hasn't happened. I'm just saying that the exposure is low prevalence, and then they're getting inadvertent testing for Lyme disease.
All right, well, let's just say someone does actually contract this disease. And we talked a little bit about, showing or having these clinical manifestations. So could you break down the clinical manifestations and what symptoms these people might actually experience?
Yeah, so, like I said, my biggest thing with these people is that they usually present with generalized symptoms when there is actually 3 very specific phases of Lyme disease: early localized, early disseminated, and late disease. Early localized disease is characterized by the appearance of a skin lesion, erythema migrans or EM, with or without constitutional symptoms. So that means general malaise, that's where you get the generalized symptoms that might happen. But you have to have some kind of lesion first. And so it's not just generalized symptoms. Usually you have a lesion. And the lesion usually occurs within 1 month following the tick bite. So it can occur long after the tick bite. So maybe somebody doesn't recall they had a tick bite, but they do have some kind of skin lesion. The next phase is the early disseminated disease, which is characterized by multiple lesions, skin lesions, that typically occur days to weeks after infection. And these can occur with some neurologic or cardiac findings. And those can occur from weeks to months after the infection. Some of these patients have no history of early localized Lyme disease, but they'll have some kind of skin lesion and then some of these other manifestations. And then late Lyme disease, which is usually what I feel like a lot of people say that present with generalized symptoms, because I think clinicians may assume that maybe a patient doesn't remember if they had a rash or some of these other symptoms. But late Lyme disease is typically associated with intermittent or persistent arthritis involving one or a few large joints, especially the knee. Symptoms may develop months or longer after initial infection and are most likely to be the presenting manifestation of the disease. So a lot of people go to their clinicians with late disease, but it's usually arthritis. In untreated patients, objective manifestations of late Lyme disease, such as arthritis, can persist for several years. So we're looking at a long course here. And on rare occasions, late Lyme disease can have more neurologic problems, like encephalopathy or polyneuropathy. So it can affect your nerves, essentially.
So it seems to me that this timely diagnosis is pretty crucial. Like, you want to catch it early.
Yeah, so if you have a rash and you have traveled to an endemic area, so you're back east, and you notice a tick on you, you probably ought to go in to see somebody sooner than later.
So why is testing not always warranted in asymptomatic cases or those with not so specific symptoms?
Well, and that's where my pet peeve comes in, because there's a huge likelihood for false positive results. So as a clinician, you got to look for, what was the exposure? Were they actually in an area where there's a high prevalence of the disease? So look at prevalence. Was there an actual exposure? Did they have some kind of rash? Serologic, so blood testing, basically serologic testing for Lyme disease, should not be performed for screening of asymptomatic patients who just live like back east, or for patients who present with non-specific symptoms. These are the recommendations that are generally agreed upon by most clinicians. So even if you have longstanding arthritis, for example, we aren't going to like jump to screen for Lyme disease. It might be on the list, but it's not going to be the first thing that we're looking for there. Anyway, so back to the false positives. As a consequence of these high false positive test results, asymptomatic patients and those with non-specific symptoms are incorrectly diagnosed with having chronic Lyme disease. And this is one of the biggest pet peeves I have, and that's why a lot of these, I guess, clinicians that aren't following society guidelines will start screening people with generalized symptoms that don't actually have the exposure, haven't traveled to the endemic areas, haven't lived in the endemic areas, they don't have the classic picture, and then they're jumping to this diagnosis when there's a high likelihood on blood testing that it's a false positive result.
Oh, I got it. So because Lyme disease is such a hot topic, and I feel like it's very hot right now, when is this blood testing, this serologic testing recommended? And then how is that going to be typically conducted?
So first off, you want to look at the exposure. Like I said, you want to make sure that the patient is actually has the exposure, has traveled or been in the endemic area, and then has had the classic symptoms like the rash. That is made on clinical grounds alone. And sometimes the patient will be like, yeah, I remember getting a lesion or something like that. And then you can, serologic testing isn't necessarily required in that situation. That's the classic clinical picture. So if you can say, oh yeah, this patient remembers being bitten by a tick, they were back east and they had some kind of rash, and it's usually a classic rash, then you can say, well, the likelihood is high, right, for that. For patients with suspected early disseminated or late Lyme disease, serologic testing can be warranted to support the diagnosis, except in patients that have like widespread rash, because then you can just make it on a clinical diagnosis. But by itself, just the blood testing, the serologic testing, can neither establish nor exclude the diagnosis of Lyme disease. So that's very important when these people go get testing and maybe they present to their clinician with generalized symptoms and they're just getting a huge amount of blood tests to shoot in the dark to say this might be the reason that you're, experiencing some symptoms. The traditional algorithm usually includes some enzyme immunoassays as well. So there is further testing, immunofluorescence assays, followed by Western blot. So those are more specific testing. And there's actually modified algorithms. Sometimes you'll do these kind of testing that are more specific for that diagnosis a couple of times.
So what you said a little bit earlier was, like, even with this blood testing, if it shows a positive for it, it might actually be positive, and if it shows a negative, it might actually not be negative. So it's not that conclusive.
No, it depends. Like some of the serologic testing, when you get into the immunoassays, they're a little bit more specific for it. But again, you have to have the clinical presentation along with that testing. That testing alone doesn't necessarily produce the diagnosis.
All right, so let's say someone had showed the lesions, went and got checked, they were back east, they actually live back east, they show some symptoms, the blood test shows positive, they do the immunoassays, and it comes back that they have Lyme disease. So how is this going to be treated, and are there going to be differences in the treatment based on the stages you actually mentioned a little bit before?
Yeah, there's great treatments for Lyme disease. It's typically treated with antibiotics. They're not even fancy antibiotics. The specific treatment depends on the stage of the disease. So early Lyme disease, for example, you do 10 to 14 day course of oral antibiotics. So these are antibiotics like doxycycline, amoxicillin, azithromycin, so nothing crazy. And then early disseminated disease, the oral antibiotics are still the treatment, but the course may be longer, like 21 days. For late disseminated Lyme disease, oral antibiotics may be used for up to a month. In some cases, like where you still have arthritis or neurologic disease, you can do IV treatments with antibiotics that may be warranted depending on the severity. For adults with early Lyme disease, the first line treatment is typically doxycycline, which is a very cheap antibiotic for 10 to 14 days. And then alternative treatments include amoxicillin. It's important to note that when treated early, antibiotics cure Lyme disease in more than 99% cases. So it isn't like some crazy disease that has no cure.
Yeah. So, I mean, you gave us all the information I think we actually really need with this. I didn't think it was that, because the way people make it seem like it's so complicated. And I would just say diagnosing it is what's complicated, not the disease itself. So what would you actually, to close this out here, what would you tell someone who like comes to you and says, hey, Dr. Eryn, my practitioner said that I have Lyme's disease? What would you tell them? Or what would you ask them? Let's hear this.
So I think, like I mentioned, the reason that I wanted to do this episode is because I see a lot of clinicians when they get a patient who they don't know how to diagnose appropriately. They go down these huge rabbit holes. And what they do is they test for every possible disease that they can. Essentially, they're shooting in the dark. And I've seen this on the list of things that they test for. And unfortunately, if some of the serologic testing, so some of the blood tests come back that maybe this person was exposed to Lyme disease or something like that, then in the patient's mind, they may have had Lyme disease and they suddenly blame all their symptoms on Lyme disease. And that is, in most cases, a false narrative. That clinician did not do you a service. They basically were shooting in the dark and did not answer your questions. So I want people to know that there is specific testing, that there is a specific clinical picture for this disease, and there is treatment, especially if you catch it early. And so if a clinician is telling you that you have chronic Lyme disease, I would be very hesitant about accepting that if you just have generalized symptoms. I think that there might be the differential diagnosis. So in other words, the list of diagnoses that might be the possibility aren't necessarily narrowed if they tell you that.
Yeah, because we have a client right now who has having a few issues and a few dizzy spells, and they really can't figure it out. And one of his doctors that he saw said, "You probably have Lyme's disease," and you're like, "No." Like, this person just doesn't know, right? So their go-to was like, "Oh, well, you're back on the East Coast. Why not just throw that out there at you?" Because it would explain why no one could figure it out what's going on.
Yeah, and I should mention that this person didn't have the correct clinical picture,
yeah,
right?
There was no
And so, but I've seen this so often, and unfortunately, like if patients are really looking for answers, they buy into this. They think, "Oh shit, this is the reason that I'm having all these chronic problems," and that might not be the right answer. And that's what's really frustrating is when you actually kind of delve into their history, it doesn't point to the clinical picture that's consistent with that diagnosis, and it gives the patient false hope that they've figured out why they're having generalized symptoms.
Yeah, everybody wants to be the hero, especially in a doctor's case, but also everybody wants an answer. And if that's something that's hard to diagnose as it is, falling back on that to, at least instead of everyone saying "I don't know," falling back on that as being the answer is an easy route to go to. So that's what we see pretty often here. But Dr. Eryn, thank you so much for giving us all this information. Hopefully, if any of you think you had Lyme disease, you would listen to this episode and get some pretty good advice. But overall, I say you basically broke everything down. And if there's any questions about this, you feel free to reach out to us on our social media. We're more than happy to answer questions for everybody. So in that case, we will see you all next week. So on behalf of Balanced Bodies, we just want to say thank you for joining us on this episode of the Balanced Bodies Blueprint.
We are committed to bringing valuable content. And if you enjoyed today's episode, we'd greatly appreciate it if you can take a moment and like it and leave a 5-star review.
On Apple, just go to the show, scroll down to the bottom and rate it there. If you're on Spotify, go to the show's page, click the 3 dots, and you can rate it there as well.
And if you believe in the power of knowledge, share this episode on your social media to try and get the information out there to as many people as possible.
And as you navigate your own path towards better health, remember that Balanced Bodies is forever in your corner. See you all next week.
The podcast content may include discussions of medical topics and health-related information. However, the information provided should not be considered exhaustive or complete, and it should not be relied upon as a substitute for professional medical advice or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition or treatment.